Hi, my name's Graham Smith. I'm an entomologist, which means I study insects, and I'm going to talk to you today about some mosquito-borne diseases. Even today, mankind suffers greatly from the burden of mosquito diseases. Increasing travel and environmental challenges is having a significant impact on the transmission of these diseases, so it's become more important than ever to protect yourself against mosquito bites. Now, while mosquitoes can transmit many diseases, this video is going to take you through three of the most concern: malaria, dengue and Zika virus. And now I'd like to explain a little bit about how these diseases get from the mosquito into humans, how they're transmitted. Now, when a mosquito bites you with its needle-like mouthparts, it not only sucks up your blood, but as it does so, it injects a small amount of saliva into your system to stop the blood coagulating. Now, when that mosquito sucks your blood, it will take up any diseases that are in your blood. However, that disease won't be transmitted to the next person unless it's able to get from the stomach of the mosquito into the salivary glands of the mosquito. So there's only a very few diseases that can do this, and those diseases are generally specially adapted for only one or two different types of mosquito. Female mosquitoes are really good at finding a blood meal. Firstly, they can pick up elevated levels of carbon dioxide. So if they're flying along and they happen to pick up a high concentration, they will turn upwind and follow that carbon dioxide back to where its source was. And as they get closer, they can pick up your heat and they home in. And then as they get really close, they can pick up the different smells on people's skin. And that's why some people are more attractive to mosquitoes than others. Only female mosquitoes feed, and they do this in order to get protein to make their eggs. Water is really critical to the life cycle of a mosquito. It doesn't need to be a lot of water, but it needs to last long enough for the mosquito to get through its life cycle. Let's start with malaria. Malaria is a disease causing a huge burden on mankind in much of the world. In 2015, 90 countries had ongoing transmission of malaria. Malaria is spread by the Anopheles mosquitoes. Now, Anopheles mosquitoes are night-biting mosquitoes, biting between dusk and dawn. They will bite both indoors and outdoors. First symptoms are fever, headache, chills, and vomiting. Now, these symptoms can be quite mild and sometimes very difficult to recognise as malaria. If not treated within 24 hours, malaria can progress to a severe illness, in some cases even death. Now I'd like to move on to dengue. Dengue is a viral disease that is spread rapidly in much of the world. The incidence of dengue has increased 30-fold over the last 50 years, resulting in 50 to 100 million infections annually in over 100 countries, putting almost half the world's population at risk. There are 4 distinct strains of dengue. Recovery from infection of one particular strain gives you lifelong immunity against that strain. However, infection by a subsequent strain of dengue increases the risk of developing severe dengue as your body overreacts in its fight against the disease. And finally, we have Zika virus. This virus has caused a lot of anxiety over recent years. Zika was first found in Ugandan monkeys in 1947, but its first large-scale infection of humans was in the Pacific Islands in 2007. In 2015, Brazil reported an association between Zika and microcephaly, a birth defect resulting in an abnormal smallness of the child's head. Like dengue, Zika is primarily transmitted through the bite of an Aedes aegypti mosquito. But unlike dengue, Zika can also be transmitted through sexual intercourse. The other 2 diseases can only be transmitted through the bite of a mosquito. It is important that all people with the virus and their sexual partners, especially pregnant women, understand the risk of Zika and take preventative measures, either the use of condoms or abstaining while pregnant. The symptoms of Zika are similar to dengue. They usually last 2 to 7 days. They include fever, skin rashes, conjunctivitis, muscle and joint pain, and headaches. Knowing how important these mosquito-borne diseases are, we now need to think about protection against these. The only real protection against mosquito-borne diseases is to protect yourself against the mosquito bite. Wear long, loose-fitting clothing. Believe it or not, mosquitoes can even bite through tight-fitting jeans. Admittedly, it's not always practical to wear long sleeves on a warm summer night, so there's going to be times when you want to use a repellent. Ensure you're using a repellent that contains either DEET or picaridin. The Aerogard tropical range contains DEET and provides up to 6 hours protection against mosquitoes. The Aerogard odorless range contains picaridin and provides up to 4 hours protection against mosquitoes.